Extended-release aripiprazole injection, also known as Abilify Asimtufii 960 mg per 3.2 ml suspension, Extend.Rel. Syringe Antipsychotics, is used to treat schizophrenia and bipolar disorder. It helps to decrease hallucinations, improve concentration, and clear thinking. It also reduces nervousness and helps to be more active in daily life. This medication is a long-acting atypical antipsychotic that works by restoring the balance of natural substances in the brain. The recommended daily dosage and the optimal timing to take this medication should be determined by a healthcare professional. Before you use this medication, make sure to read the medication guide provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. The extended-release injection should only be used if you have already taken aripiprazole by mouth without any serious side effects. Aripiprazole is given by injection into the buttock or upper arm muscle by a healthcare professional, usually once every month. Some doses may be given once every 6 weeks or once every 2 months. Do not rub/massage the injection site after your dose. After your first injection, your doctor may direct you to continue to take your antipsychotic medication by mouth for 2 to 3 weeks. This will help maintain the right level of medication in your body as you switch from receiving medication by mouth to receiving it by injection. Follow your doctor's instructions carefully. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. It may take several weeks to get the full benefit of this medication. Use this medication regularly to get the most benefit from it. To help you remember, mark the days on the calendar when you need to receive the medication. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of Abilify Asimtufii 960 mg per 3.2 ml suspension, Extend.Rel. Syringe antipsychotics, excluding select aripiprazole formulations, include dizziness, lightheadedness, drowsiness, tiredness, blurred vision, weight gain, shaking, tremors, and redness/pain/swelling at the injection site. These effects may last or get worse, so it's important to tell your doctor or pharmacist promptly if you experience any of them. Dizziness and lightheadedness can increase the risk of falling, so it's important to get up slowly when rising from a sitting or lying position. It's important to note that this medication has been prescribed because the benefit to you is greater than the risk of side effects for most people. However, it's still important to tell your doctor right away if you experience any serious side effects, such as fainting, trouble swallowing, restlessness, especially in the legs, seizures, or trouble controlling certain urges, such as gambling, sex, eating, or shopping. Additionally, this medication may rarely make your blood sugar rise, which can cause or worsen diabetes. If you have diabetes, it's important to check your blood sugar regularly and share the results with your doctor. Abilify Asimtufii 960 mg per 3.2 ml suspension, Extend.Rel. Syringe antipsychotics, excluding select aripiprazole formulations, may also rarely cause a condition known as tardive dyskinesia or a serious condition called neuroleptic malignant syndrome, NMS. It's important to tell your doctor right away if you develop any unusual uncontrolled movements or symptoms of NMS. Finally, while a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's important to contact your doctor or pharmacist. As a host of Drugs and Medications AZ, I want to highlight some important information about Abilify Asimtufii 960 mg per 3.2 ml suspension, Extend.Rel. Syringe antipsychotics, excluding select aripiprazole formulations. It's important to note that there may be a slightly increased risk of serious, possibly fatal side effects for older adults with dementia. These side effects may include stroke, heart failure, fast/irregular heartbeat, and pneumonia. It's crucial to discuss the risks and benefits of this medication with a doctor, especially if it is being considered for the treatment of dementia-related behavior problems. There may be other effective and possibly safer treatments available, so it's important to have a conversation with a healthcare professional. When it comes to the daily dosage and optimal timing, it's best to follow the doctor's instructions closely. Before taking Abilify Asimtufii 960 mg per 3.2 ml suspension, Extend.Rel. Syringe Antipsychotics, make sure to inform your doctor about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have had problems with receiving injections into the buttocks, blood flow in the brain, blood clotting problems, diabetes, heart problems, nervous system issues, obesity, low white blood cell count, swallowing problems, or breathing trouble during sleep. This medication may cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can intensify these effects. It's important to avoid driving or operating machinery until you know how this medication affects you. Be cautious when in hot weather, as this drug can make you sweat less, increasing your risk of heat stroke. It's also important to inform your doctor of all medications you are currently using before having surgery. For older adults, there may be an increased sensitivity to the side effects of this drug, so be mindful of symptoms such as seizures, drowsiness, dizziness, confusion, swallowing problems, and other serious side effects. If you are pregnant or planning to become pregnant, discuss the risks and benefits of using this medication with your doctor, as it can pass into breast milk. And if you notice any unusual symptoms in your newborn, seek medical attention immediately. And lastly, do not stop taking this medication without consulting your doctor, as untreated mental or mood problems can be serious. If you have any concerns about taking this medication, consult your doctor for further guidance. It's important to be aware of potential drug interactions that can affect how your medications work or increase your risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. One product that may interact with this drug is metoclopramide. Additionally, it's important to let your doctor or pharmacist know if you are taking other products that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Be sure to ask your pharmacist about using these products safely. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Overdose symptoms may include a very rapid heartbeat and loss of consciousness. Your doctor may perform lab and medical tests, such as checking your blood sugar, weight, and cholesterol/triglyceride levels, while you are taking this medication. It's important to attend all scheduled medical and lab appointments. Be sure to consult your doctor for more information. It's crucial to take each dose of Abilify Asimtufii 960 mg per 3.2 ml suspension, Extend.Rel. Syringe Antipsychotics as prescribed by your doctor. If you happen to miss a dose, it's important to consult your doctor or pharmacist for a new dosing schedule. In some cases, your doctor may instruct you to take Aripiprazole by mouth in addition to the injection if it has been a certain number of weeks since your last injection. Be sure to follow your doctor's instructions carefully. This medication is administered in a medical setting and should not be kept at home. It is important to follow the instructions of your healthcare provider regarding the use of this medication. Abilify Asimtufii 960 mg per 3.2 ml suspension, Extend.Rel. Syringe is used as an antipsychotic medication and is not intended for self-administration. It is important to discuss with your healthcare provider about the proper dosage and timing for this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.